Earlier, I talked to Dr. Bankole Johnson. He is the Chief Medical Officer for Adial Pharmaceuticals, and I asked him, if kids start back to school in about 2 weeks, what can parents prepare for?
I think the most important thing is that if the child has not been vaccinated, the child has to wear a mask, especially children who are younger. The pandemic is not over, and unfortunately, the spread of the Delta variant is accelerating.
Dr. Johnson, we know, though, that the mask is not a cure. And the shot gave us 90% guarantee, almost a guarantee that we wouldn't go to the hospital, that we wouldn't die. But does the mask protect our children from that same threat, hospitalization and death?
Well, it's obviously not as good as having the vaccine. But children under 12 have not been approved to have the vaccine, so the mask is all we have. So if we all wear masks, the children wear masks and the adults wear masks, and I'm saying that even adults who have been vaccinated should be wearing masks, then we will reduce the infection rate in children. Having children have COVID-19, even if they're not seriously ill, is not a good thing, because it increases the propensity for the virus to mutate and to create even more contagious variants.
The American Academy of Pediatrics is now recommending masks for all children over the age of 2. California already going back to mask mandates. Should we expect this trend across the country? And I guess a lot of people are asking, aren't we right back where we started from?
Unfortunately, we are somewhere back where we started from, which is very unhappy for all of us. The reason is the vaccination rate has been not quite where it should be. Therefore, if you look in the hospitals at the moment, somewhere between 60 and 88% of individuals who are there for COVID-19 are unvaccinated, and therefore the pandemic continues to spread. Furthermore, the stress on families is great. There is obviously a second pandemic coming, which is the one of alcohol and drug addiction, which is an important problem because as stress and isolation increases, we're now doubling down on the pandemic to create even more pandemics for the health of the nation.
So, Dr. Johnson, let me ask the question a lot of parents are asking. If you had a child, a 6-year-old, getting ready to go to first grade, excited about coming out of lockdown, excited about going to school for the first time after preschool, would you send your child to grade school?
I would absolutely send my child to grade school. And actually, I have a child that is not too far from the 6. I have an 8-year-old. And I'll send the child to grade school, but the child
My sympathies to you, by the way.
My child will be wearing a mask, and also we practice at home. We practice how to wash hands, we practice how to disinfect, we practice how to put on the mask. We do everything we can to keep our child safe. But as you know, the world out there is pretty wild, and it's unlimited what kind of contact they can have, and therefore we can only do our best as parents. But individuals, especially children who have been out of school for a long time, it's time to get back to school because we really need to catch up with education. That in itself is another problem that is brewing in the country.
And that was what I was going to ask you. You led right into my next question. Is there a greater fear of kids missing out on another year of school versus the risk of actually getting the virus itself?
Gosh, you're asking a pretty complicated question. I think that we can look at other countries for examples. So in Britain, which I track very closely because I am from Britain, what has happened there is they introduced the go to school late because they started early and they had to send everybody back home such that they did Zoom classes. They're only just getting back to sending kids to school. But what will probably happen if we're not careful and we do not observe masks properly is that we have children going back to school and then we're back where we were before, and then everybody will be on Zoom. I can tell you Zoom education for kids is pretty difficult. It is not optimal, and I have children as well. It's hard to have an adult sit at a television screen or a computer screen for 8 hours. It's very difficult to have a kid 7, 8, or 10
and we can tell you
in front of a monitor for 10 to 8 hours a day. I think it's not realistic.
We can tell you by our standpoint as well that Zoom is not necessarily reliable sometimes for television either. We were losing your signal at the end, but we got what you were saying. You were telling us about the British system. One final question before I let you go, since we've got you back. Children can't vote. They're not Democratic and they're not Republican. Should there be a federal mandate to tell everybody to get a vaccine just to protect the kids?
I would support that because I think it's very important. For example, we do have even kids can't vote. We do have mandates for vaccination in the United States. We have mandates for vaccination for children for measles, mumps, rubella, chickenpox. So it is very important that we get these vaccine mandates done. And I think what will happen eventually is what has happened in the UK, that maybe individuals who have not had the vaccine or kids who've not had the vaccine may be limited in the amount of social interaction that they're able to have, which would be a terrible shame. It would be a terrible shame for the child, be a terrible shame for our community, and it would be a terrible shame for family. I do know that there is a lot of misinformation out there about the vaccine and how the vaccine might in fact affect the lives of kids and their parents, but the truthful answer is that the vaccine is working and the vaccine is safe, and that individuals and their children should seek to get these vaccines.
Dr. Bankole Johnson joining us from Charlottesville, Virginia. I thought maybe you were going to say from London. He is the Chief Medical Officer for Adial Pharmaceutical. Dr. Johnson, thanks for being with us.